Is it true that plastic surgery is actually involving plastics?
Yeah.
So but you still know how to make yourself perfect. One more thing. How about liposuction? How much? So you saw the heart beating,
Definitely beating in front of us.
moving meat. I think we were quite curious about is how about this thing called the eyelid surgery? I think it's very common, right? Especially among ladies.
Yes, that's right.
Welcome back to another episode of Dr. Say Wan Ho. Today we have a very different doctor to come and speak to us about his profession. Usually we have doctors about knees, about spine, about the back and whatsoever. But today we have a bit different. Today we have one that is about your skin. Not really about your skin, about your looks, your face. And so today we have asked Dr. Timothy Shim Ramen. Hey doctor, good to see you. I think we can vibe.
Hi Joshua, thanks for having me on your podcast.
You're welcome. Oh, thanks to Dr. Tony instead. But still, you're welcome. Yeah, so Dr. Timothy Shim what is your Chinese name?
My Chinese name is Wing Ho, which is actually Cantonese. So in Mandarin it's called Yong Hao, so forever good.
Yong Hao. Okay, Mr. Yong Hao. Hey, Dr. Yong Hao. So what do you do? What is your profession?
I'm a plastic surgeon.
Plastic surgeon? Like you make plastic bags?
Huh? Yeah, that's my hobby. So most of the time, yes, I do work with plastic bags.
Wow.
Yeah, I insert plastic bags and I remove plastic bags.
Wait. Is it true that plastic surgery is actually involving plastics?
Not really. So the word plastic comes from a very ancient term where we use one part of the body to fix another. Yeah, so that's not really what the commercial plastic that we see nowadays.
I see. Like, what do you do as a plastic surgeon?
To see our patients, that we do some surgeries. So that's routine. But the different patients that we see are those that come either for seeking for enhancement, cosmetic requirements, but we also look at patients who need reconstructive surgeries.
So that's more of the medical side, right?
That's a more
the
medical
less
side.
aesthetic thing.
Yes, it's aesthetic and medical, but sometimes the line between them both is not so clear. Anything from aesthetic requirements require some form of reconstructive surgery. Yeah.
Oh, I see. So you were saying about enhancements. Like, what kind of enhancements do we look at?
Yeah, sometimes people want to look better and get their skin brighter, so there are various procedures we can do, either through liposuction, sometimes augmentation of various body parts like the breast, transformation of the ear. Yeah, we do that.
Cool. Wait, one last thing. What made you join this kind of plastic surgery? Is it like you like to enhance people's bodies, or? I mean, I would love to get to see some, enhancement of myself. I mean, not this part, but So what made you,
Actually, no. I started off wanting to be a heart surgeon. Actually, life has all its twists and turns. I met my previous boss while I was training as a training specialist, and he got my interest into this field. And I gave it a try and never got out. So I ended up being a plastic surgeon.
I bet his boss had a nice enhancement. So, Dr. Shim here does plastic surgery, right? You all know that now. And you can see from his skin, it's so smooth like a baby. And his whole thing looks, not to say that you look plastic, but you look very nicely constructed. You guys do it on yourself?
Actually, not many of us. Yeah.
So you guys never go through that on your own operation?
We don't operate on ourselves, definitely. And definitely not in front of the mirror. Yeah, that's right. So that's probably not what usually happens. Yeah.
So, okay, but you still know how to make yourself perfect looking.
We take care of ourselves. So we do, the normal things that everybody tells you. Have a healthy diet, engage in exercise, drink lots of fluid, keep hydrated, take care of the skin, avoid the sun. A lot of supplements creams you can use.
Avoid the sun.
That's right. Yeah.
Avoid the sun. But anyways, so you talk about not just being about aesthetic, right, but also about medical kind of like aspect where you can heal someone, right?
Yeah.
Maybe you can share to us something about like what was your most touching story about operation that you have done? Because I think you did mention something about that when we were having our conversations over coffee, right?
Yeah, sure. Yeah, there's a case that left a deep impression on me. It's a lady with a very large tumor that is eating into her chest wall, and a group of specialists, including myself, had to treat her. So a breast surgeon was involved, and also a lung surgeon was involved.
Okay.
And they first removed the tumor from the wall, removed the rib cage, and so the lungs and the heart was exposed.
Wow.
And then I was, of course, involved in the reconstructive operation, also with some of my other colleagues. We didn't expect this patient to live very long, actually, because this is a very aggressive and extensive tumor.
Yep.
But following reconstruction, she actually regained the function. She managed to walk and eat and live almost a normal life. Then she went on to live to see her children get married. And then she pulled through to even witness the birth of her first grandchild. And that was really amazing because that was really her wish, the hope that she had
To
live
fulfill
on.
her
That's
life
right,
and live her life to the fullest.
That's right.
Right.
Yeah.
But the tumor was a cancerous one or something like that?
Definitely a cancerous one, a very aggressive
A
one.
big one.
That's right.
On the chest.
That's right, on the chest.
Wow. And you had to remove the rib cage.
Yeah, the ribs were taken because they were involved, they were eroded by the tumor itself. Yeah.
Oh my goodness.
Yeah.
And you could see the heart.
That's right. It's also a first time for me to look at the heart directly like that.
Wow,
Yeah.
wow. Doctor, you talk a lot about you saw in the operation itself, you actually had to remove the ribs of the individual, right?
That's right.
So
Yeah.
how did that actually happen? How do you remove someone's ribs and then you put it back in and you see the heart and then you do all this stuff? Like what went down?
So you can see it's a very complex operation and many different specialists were involved. But to make it simple, we have to sort of like reconstruct what was removed. So with the ribs, we could reconstruct it with titanium plates, metal plates.
Okay.
And then the main chest bone is a combination of meshes and cement. So the ribs are then attached to that cement in the center. That will recreate the rib cage. But to cover all this, we have to take tissue from the back together with the skin and to cover the entire construct made of that cement and the rib cage so as to now enclose the chest wall again so that the patient can breathe and the lungs and the hearts are now protected.
Wow, so means there will be a big scar around the whole body.
That's right. Big pieces of tissue, so a lot of scars everywhere. But really the aim here is to preserve her life and to restore function.
So you saw the heart beating.
Definitely beating
Like
in front of us.
moving meat,
Yes, so the heart will beat like all of us inside of us. That's a sign of life. Yeah.
Right, I
Yeah.
see. And do you touch it like that? Do you tickle the heart?
No, we don't do that during surgery.
But that is so imaginative. Just go and hear what he said again and imagine it in your head how it looks like. And I believe you can have a very clear image, a vivid one. In fact, let's put one here if it's possible. Let's rock that one. So, doctor, that was a nice story that they just listened to you, right? About this medical stuff. But now more about the aesthetic portion. So, those who come to you, right, their face like kind of langgar by lorry like that, or like how one? Or they already quite pretty already. Or they already quite sure and they come to you, hey doctor, I still feel I'm very not pretty leh, make me prettier leh, or make me more handsome, like what happened actually?
Most patients will come and they will usually have very specific requests.
Okay.
Yeah, whether they want to have some form of surgery on their eyes or on their nose or some parts of their face. And I think the most important for us is to really assess what their real demands are and whether it is realistic and achievable.
Okay.
Right? And then we will do a detailed assessment and discuss with the patient what we can do. Yeah.
Actually, like does this like facial stuff, does it involve removing the bones and stuff like that?
Sometimes it does require that. Yeah. Sometimes it just involves what we call soft tissue, the skin and the different layers. Yeah. Sometimes it involves shaving of some bones here and there. Yeah.
Why not, let's say if now I'm your patient, okay, I come to you and say, hey, my face how?
I think Joshua looks very natural. He's a handsome guy. I think I try to make everyone look like Joshua in my clinic. Yeah.
You're very lucky, I tell you. Now I'll take you to court, I tell you. All this facial stuff that you do, right, correct? Does it involve a lot of pain when they go through the facial operation? And will they be able to enjoy their new face straight away, or will it take like months just to get recovered?
during surgery, we try to make sure that all our patients are comfortable. We give anesthesia, we cover them with painkillers. So the surgery itself should be quite painless actually. A lot of plastic surgery, the results are almost immediate because we make a change. But of course, the tissues take some time to adjust as well. Sometimes the patient may have to wait between a month to 3 months before the final result is seen.
So it means they'll be ugly for a while.
Not necessarily that they look ugly for a while, but they do look a bit swollen, a bit bruised in the beginning. And all this takes some time for the tissue to heal and settle.
Wow, so it means before they see you, their face like kind of langgar by lorry. After they see you, they kind of langgar by tank like that. And later come out and become like from charming Prince Heaven like that.
Well, with time they will look better, definitely.
But you talk about like immediate results, right? Then, for example, like what you talk about, like breast augmentation, is that like immediate result?
Definitely, yes. Yeah, you will definitely see the results.
So how many breasts have you augmented?
I can't give you a specific number, but quite a number.
So actually, I had a friend. I have a friend, right? She actually did her breast augmentation. After her operation, right, she claimed that she actually fainted and she couldn't really felt weak, felt like not so healthy, not so fit. Is that normal?
Well, that's not normal. Actually, that's very concerning. Yeah, so usually patients would recover well following surgery. And if they do feel fainting, then we have to really exclude some underlying medical problems that they have. Also, any reactions to the medications that they've just taken. Yeah.
Okay.
Yeah. So we have to make sure that the patient is well looked after. Yeah.
Oh, look. He's asking like, is it because 那个钉太大了嘛，太重了嘛，很重了，then faint 这样。
That's a good question. Yeah, usually that is not the case, but if the breast is too enlarged, yes, the patient does feel a lot of pain and very tight, sometimes it's difficult to breathe. That may cause some form of dizziness and fainting spells.
But there's a limit, right? Like the skin
That's right,
limit,
that's right. Yeah, so we actually have to assess the patient beforehand and see how much we can enlarge the breast. So it's not an infinite enlargement.
But it's like you're putting in you're putting a silicone inside.
That's right, yeah.
Will it leave a scar?
Of course, we have to make a surgical incision to insert it, and that's where the scar will be.
So there will still be a scar?
Yes, that's
right.
right.
But you hide the scar?
Yes, we hide the scar in the shadow of the breast.
Oh, wow. Sounds very literature. The shadow of my breast. So that's about it. But how about one more thing? How about liposuction? Right. What happens when, like, it looks so comfortable, like suck away my fats. It looks so easy, but is that true? Is that good? Do you do liposuction?
Of course, yes.
Suck my fats,
all
baby.
plastic surgeons will do some form of liposuction.
Okay.
Yeah, it is generally a safe procedure if you follow some guidelines, inserting or injecting some fluid in and then sucking the fat out of the different areas of the body. That is very crude, but we usually do this to actually contour different parts of the body.
Wait, how much? Like one liposuction in SGD? Can you reveal a price?
This is a secret. Yeah,
I think for me it's free, man. Hey, but why not you just do some exercise, right? Look at Dr. Ang. Just go and get fit. You may not have to go for liposuction, but you have to suck it all off yourself. All right. Doctor, so we talk about like liposuction, talk about breast augmentation, talk about facial reconstruction. One thing that I think we were quite curious about is how about this thing called the eyelid surgery? I think it's very common, right? Especially among ladies.
Yes, that's right.
I mean, you are a single eyelid, right?
I am actually I have a double eyelid, but a lot of excess skin is not covering. I have a very low double eyelid. That's right.
Yeah, I can't even see it.
Yeah.
I have a single eyelid.
Yes, you do.
Yeah, and so is it worth to get a double eyelid? And what is it like? What is the procedure like?
No, the double eyelid surgery is really a unique surgery for Orientals, that is Asians, because most of us have a single eyelid.
Yes.
Eyelid surgery really, the most common is to create a double eyelid crease. This is really done under local anesthesia, and then we make a cut and shape a crease by attaching the skin of the upper eyelid to the underlying muscle that opens the eye. And by creating a fold, then that creates a very natural looking double eyelid crease.
You mean below the double eyelid, right? It's actually a stitch, right? It's a scar.
That's right. Yeah, below the double eyelid, we're trying to create a scar, and that scar attaches the skin to the underlying muscle that opens the eye.
But then it won't be there forever. I mean, only 10 years and it will go off, right?
there are various ways in which we can do this. Some are less invasive.
Okay.
What we call like a suture or stitch kind of double eyelid surgery. And the other one is a real surgical incision, open upper blepharoplasty. So the minimally invasive ones usually do not last as long. But the actual surgery itself actually is almost permanent.
Wow, I see.
Yeah.
Because, like my friend did the one that's less invasive. So it's only for 10 years to 11 years and stuff like that. And actually, right, there was a point in time during the recovery period, you gotta ice your eyes, right? You gotta, it's gonna be really swollen, right? Correct. A pimple actually grew on that line.
Oh,
And it's just like, it's so scary. Like, how can a pimple actually grow in an area where it has been stitched up?
Oh, a pimple can grow anywhere. And so in this case, probably she's very unlucky to have a pimple there. But for a surgeon, we're also worried about whether this pimple is actually some form of infection. And so we do look out for such things. And then we treat it, antibiotics, drain any pus if there is. Yeah, it can happen.
So it means there is still a risk of infection through the double eyelid surgery.
Yeah, it is a surgical procedure. And so there is definitely a risk of infection. Yeah,
Oh.
although we try to minimize it. Yeah.
But mostly are females, right, who come for you for this double eyelid.
Most commonly, there are females who come to request for creation of double eyelid crease. But yes, we have male patients too.
Will it make me look more handsome if I have a double eyelid?
Depending on whether you want to look more male or want to look more female.
Look more male, of course.
Yes, for a male, we will create a very low double eyelid crease, and that's a natural looking double eyelid crease for a male.
What's the point?
Creating a double eyelid crease actually makes the eye look brighter and creates a highlight. So most often people say that the eyes are the highlight of the face, and people are more attracted to what the eyes look like. And so creating a double eyelid crease does create the impression that the eye look bigger and more defined. Yeah,
All right, so I should give it a shot.
definitely come to me
Please.
when you're free.
Please treat me well. Come to you when I'm free.
Yeah.
Why don't I come to you when your operation is free?
Ah,
Makes sense, right?
That's right.
I come to you when your thing is free.
Definitely.
Yeah?
Okay, for you, it's
Amen.
special.
Hey man, you got a deal, baby. Remember that if he breaks the deal, then let's take him to court. All right, let's steal that. Dr. Shim, one fast question.
Yep.
Can you remove double chin?
Remove double chin. Yes, we can. Yeah.
Permanently remove.
Well, we try to be permanent, but so removing a double chin involves tightening of the skin and also removing some fat.
Okay.
Right, and it does require some maintenance. Right, and it can come back if the patient regains weight again. So
But double chin
maintenance
is
is important.
by genes, right?
Not necessary. Yeah, not necessary.
okay,
Yeah,
okay.
usually it's a
Cool,
accumulation of excessive skin and fat under the chin.
Cool. Man, now everyone's holding the chins. Look at that, people. But anyways, not about the chins anymore, but about Shim. I mean about you, right? So we heard that you went on a mission trip. Is it true?
Yes, I go on mission trips now and then.
What is that about?
We go on different trips. So we go to some other countries, and I do go to countries like Timor-Leste. And what we do there is to try and bring medical help to the people,
Okay.
usually to the people who are living in the rural areas, who are poor,
Right.
and who have no access to medical care. So
Right,
we are there
right.
to provide some relief and
Okay.
some treatments so that they can receive the appropriate care that they are in dire need of. Yeah.
I see. So that is what you do in Timor-Leste.
I am not alone, so I must clarify that we go as a team. So there are a team of doctors that we go there. And in Timor, we provide and we share and train the local doctors there. We share some of our expertise. And then we also run clinics in the rural areas. There's a group of dentists with us. We provide dental care as well. Yeah.
So it's all for free.
That's right. We don't charge the patients. Yeah.
Also, it's just for part of your charity work, part of what you do to give back to the community.
Okay, so when we go on trips, that's what the common view is, that we are going there to just merely help the people. But the truth is, every trip that we make, we feel that we have received more from the people, and we are blessed even more, even though they don't pay us. This helps us as doctors to be down to earth again, and then to recall our mission in the first place as to why we did medicine, and that keeps us on the right footing. And that is really the best thing in every mission trip.
You mean before a mission trip, you feel you're very high?
Well, we are in a fast-paced city, and everybody is chasing after some goal, after some KPI. You want to earn a certain amount. And sometimes it's very easy to lose track of your first love. And being in an area like that helps you, refocus. Yeah.
Wow, I like what you say.
Yeah.
Thank you. You taught us well today. Learn about it. Your inner beauty. Sometimes it shines brighter than your outer beauty.
That's absolutely
Sweet,
right. That's right.
Doctor, so before we go off, right, tell us all here, right, some very, very nice tips to take better care of your skin. As a doctor, this is Dr. Say One Ho, Dr. Say One, not I Say One. What do you think?
Actually, it's a lot simpler than what a lot of people think. First things first, I think we all need to eat healthy and we need to engage in regular exercise. Simple things like this will keep our entire health, body image, even our skin healthy. Of course, other measures that we should take in sunny Singapore, we try to avoid the sun as much as we can. Of course, we can use other products to take care of our skin, moisturize, to hydrate. Of course, there are various supplements that we can take. But really, the most basic is to take care of ourselves. So what people say is true, that the inner beauty is important and it will shine through the skin.
Wait, hang on. But when I choose my wife, right, I don't think inner beauty actually is sufficient. Because sometimes your outer beauty reflects your inner IQ too, Right, doctor? If we want to look neat, we want to look good, comes on the inside as well, right?
Well, that is what the world says. But I had a very wise advice given by an older lady to me. Choose a wife that has got an inner beauty, because the outer beauty will fade with time.
But if you have you, then won't fade what?
Sorry?
If you have you, then you can fix it every day, man. Wow, shit, it's not so good. Fix like that, correct?
I dare say that if there's no inner beauty, no matter what external fix it, it's not going to work.
Doctor, this is from now on, let's call him Dr. Yummy Ramen. Sounds very good on you, actually. Whenever I hear the word Shim, I think of Shimyeon, Shimyeon Ramen. I don't know, I just think, do you think of that?
No, I don't.
Because it's dinner time and I haven't had dinner, so I'm hungry, but yeah. Have you had dinner?
No, yeah, I'm looking forward to dinner.
Alright, ladies and gentlemen, that was all we have for you. What an amazing time with Dr. Shimyeon Ramen. There was such good things that we have heard about plastic surgery. But anyways, always remember not to take care of your skin, but to like, share, and
Subscribe.
that was very anti-dramatic. But yeah, subscribe, and we'll see you again in the next episode of
Dr. Say One Ho.